I'm Dr. Sam Feresh, a neurologist and a neuroscientist. One of the most common conditions that I do approach in my daily practice is Parkinson's disease and tremor. Both of these conditions for years are known to have benefit from brain stimulations in regions which are pathologically related to these conditions. Brain stimulation is a very well-known technique for helping with symptomatic management in various neurological conditions. For instance, for people with Parkinson's disease, we know for many years that stimulating various parts of brain could assist with their symptomatic management. What we know so far is a non-invasive technique, which is very well tolerated by people who have received it with other diseases. So some recent data and research has shown that people with Parkinson's disease might also benefit in terms of their symptoms. In our clinic, we are interested to expand this possibility by involving people who are interested to join our research projects as well as clinical applications if they are eager to participate. So one of the non-invasive modalities that have been recently at the point of interest is photobiomodulation. Traditionally, many of these techniques were invasive stimulations, such as deep brain stimulation, which requires a neurosurgical intervention to insert the stimulators inside the brain. But more recently, researchers and clinicians have deviated their interest into what we call non-invasive stimulation techniques. There are different modalities that we are now working on, and of course part of my research interest and clinical interest are using these non-invasive techniques to assist patients with various neurological conditions, managing their symptoms. And on top, research has also taught us that there are some ideas about how these techniques can even enhance brain plasticity. In appropriate clinical settings where we have access to cutting-edge research-based techniques as well, we could integrate these techniques into our clinical practice as well. So these days, people might heard about the concept of precision medicine or personalized medicine, which aims to integrate individualized needs and requirements into the treatment plans. For instance, in our field, if we do have access to personalized information from brain activity in different locations, or even the heterogeneous phenotype of a particular disease, we can then design a personalized intervention program for that particular person with that profile. And brain stimulation is, of course, a big part in this approach for symptomatic management.